Why does therapy so often suck for men?
So there are a couple of reasons for this. The first is that I think we have a misunderstanding. Somewhere along the way, we got the impression that talking about our emotions is the best way to handle them. So I think we have a bias about our understanding of emotions. We think, first of all, they're primarily mental. Secondly, we think that talking about them is the way to go. And therapy is the best evidence-based approach that we've got, basically historically, of dealing with your emotions. But I think there are a couple of biases. The first is that the majority of therapists are women, and the majority of patients are also women, historically, which means that if you're looking at a population and you say talking about emotions really works for my patients, if you're just a therapist, we don't really segregate between our male patients and our and our female patients. We sort of like look at this and we say like, this is what works. Now, there are lots of trials that actually show the opposite of that. So we'll have trials on cognitive behavioral therapy that look at 50% men, 50% women. Both of them have good effect sizes. But there too, I think there's a selection bias. Because even if you're looking at success in therapy, you're not counting all the people who left.
That didn't go to therapy in the first place.
Because talking about emotions did not work for them. Yeah. There's even a really interesting paper, so there's a lot of exploration into this. And one paper actually points out that there are two kinds of therapy that you can give. One is what we call emotionally supportive therapy, where you talk about your emotions. And the second is something called instrumental support, which is like problem solving. And what we tend to find is that men prefer problem solving. But if you look at therapy training, we are actively disincentivized to problem solve with our patients. We're not there to solve your problems. So when I was like a second year psychiatry resident, and I had this 16-week therapy course where I'm learning the basics of therapy. And, you know, one of the teachers came in and was like, if a patient walks in and says, "Can you help me find a girlfriend?" What's the right answer? And then the right answer is that, help me understand why you think you can't find one. Help me understand why you want one. Let's talk about it. The answer is not yes, right? So as therapists, we're not very good as a whole profession at like helping people solve problems. And I think especially if you look at men, there's a lot of disturbing data on diseases of despair. So between, I think, like 2009 and 2018, suicide-related diagnoses in people under the age of 18 went up by 287%. So what's happening right now, especially if you look at male mental health, is we're starting to realize that there's another study, for example, that there are a couple of studies that show that somewhere between 37 and 66.7% of men who commit suicide, somewhere between 37 and 66%, have no history of mental illness. So what we're starting to realize is there's a very troubling signal that we're seeing that people who kill themselves may not be mentally ill. They may actually have a life that they've just mentally checked out on. They've looked at their situation, they've tried to fix it, and they just have nowhere to go. And we're seeing this especially as we see things like changes in our economic situation, changes in employment or underemployment. There's a lot of economic forces that are affecting men. And so now the problem is that, especially when I work with my male patients, what I see is sometimes when they come in, they'll say, okay, I feel suicidal. I have low self-esteem. Okay, I diagnosed you with depression. Tell me about your life. I'm 30 years old. I have no job. I've never been in a relationship. And so like, what would this person look forward to, right? And so a big part of helping them is not just talking about your problems. A big part is helping them build a life. And that's not something we're trained in as therapists.
Does this require an entire new type of therapy? It almost, to me, based on what I know about the definitions of therapy, almost sounds like it gets into some kind of coaching in a way.
Yes. So I think that's why coaching has emerged as a field, right? So I think that what started happening at some point is therapists stopped focusing on material outcomes for their patients. So if you look at how we judge the quality of a therapist, it's the reductions in their depression scores, anxiety scores, which I think is completely reasonable, right? That like makes sense because that's what our job is. But we certainly don't measure things like promotion or what percentage of people get married and things like that, which is if you really look at like what makes people's lives worth living, it's those kinds of achievements. And even if we look at, so the really fascinating thing is if we look at the evidence-based methods of therapy for diagnoses that are predominantly men, we see more action. So a great example of this is something called motivational interviewing. So if you look at addictions, the majority of people who have addictions are men. And if we look at what is the best evidence-based technique, maybe not best, but one very effective evidence-based technique, it's something called motivational interviewing, which is all about getting people to do shit. It's not about talking about your feelings. We're not going to examine your dreams or things like that. It's like, you have this goal. How can I interview you in a way that increases your motivation and moves to action? So we actually see that, where there are some diagnoses that are predominantly men, where the technology that we use, the therapeutic technology that we use, is action-oriented, is instrumental. And we talk about emotions and stuff, but the emotions is not the end. It's a means. How can we understand how these negative emotions are impacting your actions and preventing you from achieving what you want? So we absolutely see that signal in therapy.
We'll get back to talking to Dr. K in 1 minute, but first, I need to tell you about Momentous. You might have heard me say that I took my testosterone from 495 to 1006 last year, and 2 of the supplements I used throughout that were Fedoja agrestis and Tonkat Ali. I first heard Dr. Andrew Huberman talk about these really impressive effects, which sound great until you realize that most supplements don't actually contain what they're advertising. Momentous make the only NSF-certified Fedoja agrestis and Tonkat Ali on the planet. That means they're tested so rigorously that even Olympic athletes can use it, and that is why I partnered with them. So, if you're not performing in the gym or the bedroom the way that you would like, this is a fantastic place to begin to naturally improve your testosterone, and there is a 30-day money-back guarantee. So you can buy it, try it for 29 days, and if you do not like it, they will give you your money back. Plus, they ship internationally. Right now, you can get 20% off everything site-wide by going to the link in the show notes below or heading to livemomentous.com/modernwisdom using the code modernwisdom at checkout. That's livemomentous.com/modernwisdom and code modernwisdom at checkout.